Hello and welcome to Askimo TV. I'm talking today to Dr. Prasad Kothari. Dr. Kothari is a consultant ENT, head and neck surgeon in the UK. He has a special interest in head and neck and thyroid cancer, as well as in sleep apnea and snoring. Hi, Dr. Kothari. How are you?
Good morning, Joanne. Very well, thank you.
Wonderful to be talking to you today, Dr. Kothari. Dr. Kothari, let's talk today about middle ear infections. So what are middle ear infections?
Middle ear infections are very common. It's something what in medicine we call acute otitis media. So it stands for infection in the middle ear. It's very common in children, not very common in adults. And typically it can start as young as, in a baby as young as a few months, going on up to until they are 6, 7, 8, or sometimes even later than that. Typically it may present as a painful ear, where the baby may be pulling the ear, or in a child, the child will say, my ear hurts. It may also have fever, and after a few days, they may get a discharge from the ear. But middle ear infections are very common.
What causes the middle ear infections?
Because the middle ear cavity is connected via a tube called the eustachian tube to the back of the nose, and the lining of the middle ear is same as the lining of the rest of the nose on the inside. Any infection, like a viral infection, which can cause a cold, or upper respiratory tract infection, can cause a middle ear infection. In vast majority of cases, initially it is a viral infection, which can last a few days and then get better. But from there on, you can also get a bacterial infection, which can cause fever, pain. So it initially starts as a viral infection, generally.
And what can happen if it's left untreated?
Firstly, it's very painful. Any infection in the body needs treatment. And though the antibiotics is a treatment that we recommend, it's not for the first 24 hours because some of the infections, if they're viral, will settle on their own. And just giving the child paracetamol or Calpol will be adequate to control the pain and the fever. But if it's untreated, infection like a middle ear infection will run its own course. So within a few days, the eardrum might rupture and they may get a discharge, and that would lead to resolution. But in rare cases where the treatment is not been given, can lead to complications like infection spreading from the middle ear into the other areas, for example, into the mastoid, which is a bone at the back of the ear, causing mastoiditis. It can also cause infection traveling up into the brain or the cranial cavity, causing an abscess either outside or inside the cavity of the brain. So there are some serious complications of acute otitis media if it is not treated.
And what sort of treatment options are available?
Generally, for acute otitis media, vast majority of these will get better without any antibiotics, but paracetamol to control pain and fever. If it doesn't settle after the first 24-48 hours, then we would recommend antibiotics. In some individuals where they don't respond to antibiotics, they may need to be admitted to hospital for intravenous antibiotics. And very, very occasionally, if there is a complication of the middle ear infection, we sometimes have to put them to sleep and drain the infection through a tiny little cut in the eardrum. And that is really just to relieve the abscess and help resolution of the infection.
What happens in a child that is continually getting middle ear infections? What sort of reasons could there be for this?
Right. That's again quite common. We see for a few children who get infection, within one episode after the other. Sometimes these people who are just prone to it because of the surroundings they are in, because children go to nurseries where some or the other child always have an infection and these people just pick it up. It could be because the resistance is low. There are certain children who have got deficiency within their immune system that can cause it. So if this is happening, it may be worth checking their immune system by doing a blood test. In some individuals who are getting recurrent infection, there are other options, treatment options. One of them is to use long-term antibiotics. When I say long-term, we are looking at a period of at least 2 to 3 months on a low dose. Or in some individuals, we also put a grommet within the ear, which is a small ventilation tube, and that would reduce the risk of recurrent infections. But it has to be discussed and catered to individual child to see what the requirements are.
If you do insert the grommet and the middle ear infection keeps occurring each time the grommet is ejected, what then would your thought patterns be on what the problems could be?
If in spite of the grommet the child is getting recurrent infections, then I think one really has to think, has the child got other immunological conditions? And that's when we would probably consider referring the child to the pediatrician. Because if they are just getting infections, then they're probably also getting other problems like an upper chest infection. So these people may need a long-term medical treatment from a physician in addition to being seen by an ENT specialist.
And Dr. Kothari, just to end off, is it possible to prevent middle ear infections?
Well, it's usually difficult because we all live in an environment where we are always exposed. And it's not a bad idea to get some of these infections early on, because as we grow, we will get resistant to them. So no, it is not possible to completely protect yourself from these infections. But because most of these infections do not have long-term consequences, they are short-lived, they generally have no long-term problems.
Thank you, Dr. Kothari. Thank you so much for talking to me today.
Thank you.